Okay, so this is just a men's health question and answer. Some of the questions you have to focus on, but you can still do more questions. So we have a first question here. So one thing I realize is that when you're talking about medications in men's health, at least you should know the medication for BPH, know the medication for prostatitis, epididymitis, erectile dysfunctions, so balanitis. So at least know those medications because it's really high yield. So, and another thing about men's health, you need to look at the age. Age of the patient is very important because age of the patient can determine your answer. So we have this question. This question is, and I must say that this question, I'm not the originator. You can always find all these questions from everywhere. I just have to compile it and make it more understanding for the student. So, but if you want more questions, you can refer to my book. So, a 71-year-old male patient is taking Avodat. These are the kind of things you need to know. Somebody will say, what is Avodat? So Avodat, and they made it simple for you to know, is a 5 alpha reductase inhibitor. So what medications are 5 alpha reductase inhibitors? You need to know that. What effect might this have on his PSA? So will it increase the PSA? Will it decrease the PSA? There is no predictable change. There will be a clinically insignificant increase. So I just give you a few seconds to answer. A 75-year-old male is taking Avodat, a 5 alpha reductase inhibitor. What effect might this have on his PSA level? So if you choose the answer that it will decrease it, you are correct. So if you remember what we said, when a patient is on Prosca, remember the guideline, when a patient is on Prosca, that the PSA, you need to do what? Multiply by 2 because it's going to reduce it, it's going to shrink it. And we need to know what 5 alpha. So the 5 alpha reductase, if you know when I was emphasizing reductase, they reduce. So there are two classes of medication more we use for the treatment of BPH. The first one is your alpha blockers, okay, where you have your flonase, flow mass, and your hytrin. So we say that if somebody have a BPH and hypertension, you are going to use hytrin. So they are usually the first line. Then the second medication is your 5 alpha reductase. From the word reductase, you are reducing. You are reducing. So the medication there is your Prosca because the Prosca does what? It shrinks it. Another medication there is Avodat. Avodat is not really common, but know that they can tell you Avodat, they can tell you Prosca, because if I use the word Prosca, most of you knows Prosca, but take note of that. Then another question: a patient with testicular torsion. So when somebody have a testicular torsion, what would this patient have? Positive climateric reflex on the affected side, negative climateric reflex on the affected side, a positive climateric reflex bilaterally, negative climateric reflex bilaterally. So, and if you know what the answer, I give you a few seconds to answer. So when we talked about testicular torsion, we say that there is two signs in testicular torsion, which is the climateric sign or reflex and the pharynx sign. Okay, remember that. So we said how to differentiate testicular torsion from epididymitis is that in in testicular torsion, these these things, which is the chromateric reflex and the pharynx sign, they are going to be negative. They are going to be absent. They are going to be missing. So it's either you use the word negative, absent, missing. But in epididymitis, they will be present, they will be positive. So the answer is B, because they are going to have a negative. So, what is negative cremateric reflex? We say that when you tap on the thigh, you are going to have like a kind of movement. And foreign sign is when you glove your hand or when you use a towel to kind of lift the scrotum, they are going to have some kind of relief. So, please know that for your testicular torsion. And for testicular torsion, we say that they have to go to ER and they have a 6 hours window. Okay, so very important, negative climateric reflex, negative pharynx sign. So if you look at the options, they do it in kind of way to confuse, but the answer is negative climateric reflex. So you can use the word negative or missing climateric reflex or absent climateric reflex. Question: what is the recommendation of the American Cancer Society for initial, that was, I've already answered this, initial screening of an African American male? So the buzzword here is African American male. Okay. So for prostate cancer, so digital rectal examination starts at 40 years. PSA starts at 45 to 45 years. Discussion starting at age 40 to 45 years. He should be screened starting at 50 years. So if you remember what I just explained now, the answer is C, because we said that the buzzword is African America. And another thing to remember is if the African America and they have a family member with prostate cancer or that died of prostate cancer, okay, relative, close relative, okay, so it's very, very important that you start them. So another question can be, you have a patient is 40 years old, patient is African American, and patient comes in and asks you, okay, what is your recommendation? So for the fact that the patient is African American and they have somebody that already died, okay, of that, it's always good to do what? To, you can recommend that. You can recommend that. Then we have another one. So prostate. So I'm just, this is a rationale. Prostate, it start at 40 to 45 years for high risk male, which makes them African American, and the somebody that the relative. So everything that I explained. Okay. If and for 80-year-old 80-year-old white male present for an annual exam. He complains of difficulty initiating his urinary stream but denies burning and urgency with urination. On examination, he is found to have a firm, smooth, non-tender, and symmetrically enlarged prostate. What is the diagnosis? I think this is simple, but let me give you little time to answer that. So if you say BPH, you are correct because it's very important. If you say BPH, you are very correct. So the buzzword there is what? Symmetrically enlarged. When you hear the word symmetrically, which means both prostate, symmetrical. When we talk about asymmetrical, nodular, you are thinking about cancer, prostate cancer, but this is um symmetrically enlarged. Okay, symmetrically enlarged. So that word is your BPH. So that one is really simple. And sometimes they can also ask you what is the, which is the supplemento, what is the herbal medication supplement to help. Okay, so this is, you need to know these four conditions. Is really high yield in the exam. BPH. How do we describe BPH? Firm, smooth, symmetrical, enlarged prostate. Okay. Epididymitis, we say that epididymitis, you can describe it as what? Scrotal heaviness, pain, okay, epididymal tenderness. If they can describe it as swollen, red, okay. But bacteria prostatitis is always warm buggy, okay, warm buggy. Then cancer is your induration, enlargement, asymmetrical. So know these two things so that you don't get it confused. Asymmetrical and symmetrical is not the same. Symmetrical is both side, but when something is one side, asymmetrical is totally different. Asymmetrical, okay? Asymmetrical. Okay. Then another one is digital rectal exam may be performed to assess the prostate gland. Which term does not describe a prostate gland that may have a tumor? So, which of the following is not a word you can use to describe tumor in prostate gland? Nodular, asymmetrical, buggy, indurated. I have mentioned this uh, a lot. So, you need to know that. So, that will be your buggy. I have explained it. Buggy, the word buggy is mostly for prostatitis. Men's health, you need to know that words is very important. So, like nodular is potential tumor, asymmetrical is uneven enlargement, indurated is abnormally hard. When you say that something is indurated, it's abnormally hard. Okay, so please know those terms. So buggy is the one that is out. Hematuria is not a common clinical manifestation. Is Please, this question is really high yield. Hematuria is not a common clinical manifestation in where? In is it in early prostate cancer, benign prostatic hyperplasia, bladder cancer, renal cancer? Okay. So if you answer early prostate, the buzzword is early prostate cancer. And that is why so many of them don't even know that something is going on. Okay, you will always see hematuria in benign prostate hyperplasia. I know some of us may be getting towards benign, but the buzzword here is early prostate cancer. So you may not have that hematuria, and that is why so many people may not even recognize that something is wrong until, because people don't get worried when they don't see some of these things, but when they start seeing bleeding in blood in the urine, pain, that is when they do something. But outside that, people don't tend to do something quicker. Then these are the conditions that you can see, like we said, renal cancer. Of course, there'll be bleeding. Prostate, commonly associated with hematuria due to enlarged prostate. Bladder, too. Bladder cancer frequently presents with hematuria as a primary symptom. A 28-year-old male presents a 28-year-old male patient has epididymitis. What is his most common complaint? So when somebody have epididymitis, I've also answered this one. This one is straightforward. And another thing you will remember, if you remember my video, 28 years old. So this is when, if you remember the how I broke down epididymitis and prostatitis. I said when they are less than 35 years, you treat it as STD. When they are greater than 35 years old, you treat it as UTI. So they have given you a point here. Patient is 28 years old. So, but what do we see in presentation of epididymitis is usually that scrotal pain, scrotal swelling, scrotal redness. You are going to see those symptoms. So it's very, very important to remember that what you can see, scrotal swelling, okay, redness. So those are the things you can see, swelling, tenderness. Sometimes they are going to have fever. And I said if they are less than 35 years, you also need to watch out for chlamydia and gonorrhea. Chlamydia and gonorrhea. So that is very, very important. The chlamydia and the gonorrhea. If they are, but if they are greater than than 35 years, then that will be Escherichia coli, E. coli. Then look at the medications for BPH. I talked about it. The alpha blocker, the 5 alpha reductase inhibitor. Okay, sometimes they can use um, the diuretics are not specifically indicated for BPH treatment because it may worsen the symptoms. So the two medication here is the alpha blockers. So let me just remove this so that we don't get confused. This is supposed to be another point. But the two medications we use is the alpha blocker, and I explained it that alpha blocker is your Flomas and Hytrin. Then you have your 5 alpha reductase. These two medications you must know for the exam. You must know. A 70-year-old male presents to your clinic with a lump in his breast. How should this be evaluated? Palpation and ultrasound, mammogram and ultrasound, ultrasound only, mammogram only. So if you answer B, you are still correct because people don't know that male can have breast cancer. Okay, so the same male breast lump requires the same evaluation as female breast lump. So it's also important that they do mammogram and ultrasound. So the same treatment, and don't ignore it because they can also present with that. So very important to know that because they can also present with that. So just know that it's very important when they present the same thing. You can do mammogram, you can do ultrasound because the reason we do the mammogram, you want to see the palpable masses. If there's a mass, you want to see that. Then the reason you do the ultrasound, it helps to differentiate, and this is also high yield in the exam. They can also do ultrasound. The ultrasound will do what? Will show you will differentiate between the solid and the cystic lesion. Solid and the cystic lesions. Okay. Then they can also do fine needle aspiration for biopsy. But just know that it also requires a prompt evaluation when a male presents with breast lump because you want to rule out, is this gynecomastia, is this lipoma, is this malignancy. So don't just ignore it, please. Okay. What symptom listed below might be seen in a male patient with BPH? So this is high yield and this is very simple. Dysuria, nocturia, low back pain, pain with bearing down. So BPH is really high yield um, in the exam. Okay, so know that it's very, very high yield in the exam. BPH. So for BPH, you see, you need to know all is non-cancerous enlargement of the prostate. They are going to have urinary frequency, nocturia, weak stream, incomplete, emptying. Okay, and we say that we use two medication, which is the alpha blockers, 5 alpha reductase inhibitor. Sometimes they can do the same medication they use for, which is the Viagra, okay, and they will do surgery. But the two medication we have emphasized so much on that. So the answer is B, nocturia. Also no other symptoms. And we talked about medications to avoid in PPH. I put a long list in the video. So if you remember the mnemonics, so one of those medication is antihistamine, especially di diphenhydramine. This is like Benadryl. This is really high yield in the exam. You need to avoid it with patients that have BPH because it can cause urinary retention. Also, other medications to avoid, TCA is really high yield in the exam, amitriptyline, imipramine. So know that because they have even narcotics, muscle relaxants because they have a anticholinergic effect. So generally safe options. So these medications um safe with BPH. So another question. A 25-year-old male patient is training for a marathon. When I see this, I already know what they're talking about. He reports an acute onset of scrotal pain after a 10-mile run. He has nausea and vomiting. Another nausea, but vomiting is also there. To have asymmetric high riding taxis on the right. This is a buzzword. High riding taxis. High riding. So the answer, if you say testicular torsion, you are correct. Anytime you hear high riding, high riding, anytime you hear high riding, testis, you are very correct. Then you have a prostate cancer screening. So this is it from 40 to 45 years for African America, age 50. And you need to know the PSA reading. Okay. If it's greater than 2.5, annual testing. If it's less than 2.5, they have to do every 2 years. Less than, remember, less than 2.5. Then if it is greater than 4, if it's greater than 4, you can, so greater than 4, you have to refer. Then greater than 10, you do biopsy. These are all the things we studied in the video for men's health. Okay. Then we have epididymitis, which I have explained. For epididymitis, if this patient is less than 35 years old, you are going to be treating chlamydia or gonorrhea. Sometimes they can ask you the organism you are treating them for. Sometimes they can also ask you the medication. So if this guy have epididymitis and patient is 35 years old, you'll be treating them for epididymitis. So you are going to do, if it's chlamydia, you are going to do azithromycin or doxycycline. Okay, then if it is gonorrhea, you are going to do ceftriaxone. So please, it's very important that you know this. Then you need to know what is phimosis. We covered all these things in the video. So these are the factors that can affect PSA level. Okay, this percentage may not be that correct, but just to know there are factors that can affect the PSA level. One of the factors is infection. Another factor is digital rectal exam. Okay, so the factors that affect PSA level, one of the factor is digital rectal exam, prostate biopsy, ejaculation, infection. So always take note of that. Those are factors that affect PSA level. Then what is the action of pi alpha reductase inhibitor? We have talked about this. What is the action So the is it to dilate of the distressor vessel, a decrease in the size of the prostate, increase blood flow to the prostate, inhibition. So the answer is a decrease. They decreases, they shrink the size of the prostate. Okay, they decrease it, they shrink it. Okay, so Helsabeck's triangle form the landmark for what? Is it inguinal hernia, femoral hernia, abdominal hernia, umbilical hernia? So I know this one you need to think a little bit, but if you say inguinal hernia, you are correct. It forms a hallmark, a landmark for inguinal hernia. Okay, so always remember that the Hellsbeck triangle is also known as inguinal head triangle. Okay, so it's the landmark in the anterior abdominal wall. So please don't forget that. It's very, very important. So it's also known. It is clinically significant because it represents an area of potential weakness. So you know that herniation is like protrusion. Okay. What is the recommendation of AC American Cancer Association for screening for 40 years old? So this is different now. First of all, this person is 40 years old and this person is Caucasian. I didn't say Africa. This is Caucasian. Digital rectal exam, serum, which is PSA, digital rectal exam, he should be screened starting at 50. So the answer is he should be screened starting at 50. If this patient is African American, then we start 40 to 45. Please take note of that. So this is the screening again. I think we have covered this slide already. And we have covered a 50-year-old comes to the nurse practitioner clinic for evaluation. He complained of chill, pelvic pain, dysuria. He should be diagnosed with what? Acute bacterial prostatitis, chronic bacterial prostatitis, urinary tract infection, and non-bacterial prostatitis. So if we said acute, that will be correct because patient is having chills. Anytime somebody is having something acute, you are going to see chills, fever. Okay. Another thing you may be seeing is pain. Most of the time, when something is chronic, is the person is already managing it, but pain is less. About anything acute, there will be like an acute form of pain with that. So I think this is the end of the question.